So my best friend from college became a neurosurgeon. He actually died kind of unexpectedly. It'll be a year ago this coming Monday. But I occasionally go visit him. I'd flip through journals that he had on the shelf, like Journal of Neurosurgery or New England Journal of Medicine or whatever. And there were always some real howlers in these absolutely top-notch journals, just brutally terrible examples of how not to do an experiment, but published in a first-rate journal. So this is one of those. All right, so let's read this and talk about it a little bit. Okay, so here in the early to mid 1990s, there was an experiment done. Excuse me. At Mass General Hospital, which is a first-rate hospital, and it was looking at doing basically brain surgery to treat psychiatric disease that wasn't responding to other kinds of treatment. And basically, there were, it was a relatively small sample, which is maybe a good thing in this case, normally not. These people had all been referred by the psychiatrists who were treating them. They were reviewed by some panel that was studying this treatment. And most of the panel were actually authors of this journal article. And if the committee agreed unanimously the patient should get the procedure, and the patient consented, then and the sort of some of the things they looked at in deciding whether or not to do this surgery were, had they, they didn't respond to drugs, they didn't respond to psychotherapy, they didn't respond to behavioral therapy, and they didn't respond to electroshock. Another nice humane thing. Okay, so, and then they had to have been sick for at least a year, and they had to have what was considered a serious psychiatric disease, major affective disorder with unipolar depression, bipolar depression, developmental disorders, OCD with major depression, blah, blah, blah. Okay. And then there were some patients who were given the surgery. Some of them who didn't get better were given a second surgery, which is a wonderful medical model. If it doesn't work, do more of it, right? That's all right, so the cingulotomy procedure is basically they fry your brain. They drill some holes through your skull, and they pass radio frequency electrodes, a very, very high frequency, high voltage through the electrodes, which basically cooks a piece of your brain. And they cook it for something like 90 seconds. And in 1993, they modified the procedure so they cooked a little more of your brain. All right, so of the 34 subjects, there were 31 who were available for follow-up assessment of some kind. Of the 31, 2 had committed suicide. I mean, this is not funny, but it's funny, right? Okay. The assessment was done in one of two ways. Either the person who had referred them to go get this treatment, or the psychiatrist who was in charge of the treatment, completed some questionnaires, or if the patient wasn't seeing anybody anymore, thank you very much anyway, they looked at the most recent correspondence with the patient and tried to assign ratings based on that, like, I'm fine, doctor, really. Okay, I'm sorry. This is horrible. I couldn't figure out. I couldn't find in the article how many patients were in each of those categories, but they basically ended up categorizing people into one of two categories, either a responder, or three categories: a responder, a possible responder, or a non-responder. All right. So 14 of the patients who hadn't responded 6 months after the initial procedure had more procedures. then, and this is, kind of the summary of what happened. All right. So is this an experiment or an observational study or just a really, really sick joke? Yeah, okay. Yeah. Okay, so there's nothing to compare it to. So the method of comparison is not being used, right? Does that mean that it isn't an experiment? They choose who gets the treatment. Okay. So it's an experiment, but with no controls. Does that make sense? Is there any randomization? No, they're just treating the people who were referred and who they decided to treat for whatever reason. All right. Now, if you wanted to know whether this stuff worked, right, the first thing you would need to do is to compare it to something else, right? Because even if people have been sick for a year, that doesn't mean that they won't ever get better from some other treatment. And so if you somehow want to know whether it's worth cutting people's heads open and frying their brains, you might want to compare the recovery rate for this group to the recovery rate for some other group that had some less invasive treatment, like just electroshock, for instance. Okay. All right. So there's going to be a problem from confounding, right? I mean, it's sort of there's no controls. You have no idea why the people who got better got better. Why was that? All right. So in particular, even if there were no direct psychological effect, direct effect on your, I mean, it's hard to believe that it doesn't affect you at all, right? But that even if it didn't affect the symptoms of your psychiatric disease, the fact that you've undergone brain surgery, you know that that happened to you, right? Okay? So would you expect there to be a placebo effect? No? You know you were being treated. Yes. Okay, right? So what's the idea of placebo? You give me a pill. I don't know what's in the pill. I know I'm being treated. My pain gets less. My pain decreases, even if what's in the pill is sugar, right? That's the placebo effect. Placebo effect is knowing that you're receiving treatment of some kind, whether that treatment has an intrinsic effect or not. The knowledge, the beliefs around it affect the outcome. That's the placebo effect. Okay? Does it? All right? So you don't have to be given a placebo for the placebo effect to matter. The reason people are given placebos is to eliminate the confounding due to the placebo effect, so that you're comparing, so that the difference between the treatment group and the control group is not whether they got something, it's the difference between what they got, right? Okay, so the placebo effect is likely to be a source of confounding here. Does that make sense to everybody? Okay, because everybody knows they got brain surgery, yep. Whether or not the brain surgery actually matters. Okay, who is doing the evaluation of the subjects here? Is this a blind experiment? Is this a double-blind experiment? Neither one. Okay, so who's evaluating the people? The very same people who recommended that they get the treatment and who are putting their names on the article and taking credit for how wonderful this is when it's over, right? So would you expect that, consciously or not, there would be a tendency to interpret people's behavior, et cetera, as improvement, even if there were no real improvement, okay? All right, so this is likely to play a role.